Which of the following is a membranocartilaginous bone? Mandible. Doppler technique of imaging is used to monitor blood flow. Deletion of one arm on the chromosome 5 is Cray-Dou-Chat syndrome. Most critical period is 4 to 8 weeks. Sebaceous gland originate from the epithelial sheet. Amniocentesis is considered safe to be performed after 4 weeks. What effect will a short umbilical cord have on placenta? Early separation of placenta. So mites arise from the paraxial mesoderm. The occipital myotome forms muscles of the tongue. After fertilization, the trophoblast release immunosuppressants around 24 to 48 hours. Secondary oocyte is arrested in metaphase 2, which is completed at fertilization. Injury to which of the nerve causes pinch point deformity? Anterior interosseous nerve. The third compartment of extensor retinaculum has the following structures: tendon, passing, and rate. Extensor pollicis longus. In order to check the head of clavicular head of the pectoralis major, which movement is done against resistance? Flexion. Which ligament prevents clavicle joint with scapula from dislocating? Coracoclavicular ligament. The prime mover against supination is brachialis. What is lateral to median nerve at the level of wrist flexor? Carpi radialis. Deltoid ligament prevents subluxation of ankle joint during eversion. Which nerve is most commonly damaged in the person who jogs regularly? Medial plantar nerve. Which of the following is a nutrient artery for tibia? Posterior tibial artery. Abduction of thigh at hip joint is function of which muscle? Gluteus minimus. Root value for the ankle reflex is L4 and L5. Third perforating artery in the thigh arises from just below the adductor brevis. If a surgeon inserts a finger in the transverse pericardial sinus, which structure would be lying posterior to his or her finger? Superior vena cava. Which of the following structure is present both in superior and posterior mediastinum descending vagus nerve? A child accidentally aspirated a peanut while popping one in his mouth. Where is it most likely to lodge? Right apical segment of segmental bronchi. Attachment of cervical pleura. Which of the following? C7 and inner border of first rib. Clara cells are present in the bronchioles. What type of neuron comprises the autonomic ganglia? Multipolar. And white matter in a cross-sectional spinal cord contains myelinated fibers, myelinated axons. What cells are present in a zone of hypertrophy? Fibroblasts. In what structure there are no lymphatic spinal cord? Dome cells were seen in specimen of epithelium under the microscope. What epithelium could have been under observation? Transitional epithelium. In the process of the atherosclerosis, lipids deposit in which layer of vessels? Tunica intima. Vena cordis minimi open in the heart. Subscapular sinus is present in the lymph nodes. Person died from myocardial infarction 1 month back. His heart muscle may show some infarcted area. This infarction area will be abundant in the connective tissue. Tendons are composed of which of the following structures? Dense, regular connective tissue.